Suppose you need to print test report in A4 size letterhead. Suppose you have letterhead having printed material in top of the A4 paper sheet. After saving test result and before seeing print preview of test report, make sure that in report printing options, letterhead option is selected. Based on nature of the test result, either click on print non-culture and sensitive report button or click on print culture and sensitive report button. Print preview of letterhead test report is generated. Here you can see blank space in top of the report. This blank space is used for printed material in top of the letterhead. In this blank space there will not be any printing, so printed material in top of the letterhead will remain intact. Thereafter, patient details and test result will be printed. Print this report. In printed report on letterhead, you can see gap between already printed material of letterhead and patient details. To reduce this gap, you need to reduce height of the blank space in report print preview. To change letterhead blank space setting, click on Application Settings submenu of Tools menu. Application Settings form is opened. Here you can see letterhead blank lines are set on 14. To reduce height of the blank space in report print preview, decrease letterhead blank lines. Suppose you are setting letterhead blank lines to 10. Click on Save button. Regenerate print preview of test report. You can see height of the blank space is reduced. Print this report. In printed report on letterhead, you can see overlapping between already printed material and patient details. Here you need to slightly increase height of the blank space. In Application Settings form, set letterhead blank lines to 11. Click on Save button. Regenerate print preview of test report. And print report. Now you can see in printed report on letterhead, patient details are coming just after already printed material, which is perfect. But here in report, you are able to see that dummy doctor details are coming in bottom. Instead of dummy doctor details, you want to give other doctors details there. Close report print preview. To add new doctor details, either click on add edit sign button or close other test result form, then click on signature prototype submenu of maintenance menu. Suppose you are clicking on add edit sign button. In signature prototype form, to add new doctor details, click on add new button. After finishing, click on save button. Close signature prototype form. In other test result form, select my sign from right sign drop down list and generate report print preview. Here in report print preview, you are able to see doctor details which you have added. Print this report. Close report print preview. Close application settings form. But here, if you are going to reopen other test result form, you will find Rathi Sai is selected in right sign drop down list. So here, before generating print preview of report, you need to select my sign once again from right sign drop down list. To make my sign selection permanent in right sign drop down list, open application settings form. Here select My Sign from Right Sign drop down list and click on Save button. Reopen other test result form. You will find My Sign is selected in Right Sign drop down list. Suppose you have letterhead having printed material in top and bottom of the A4 paper sheet. In this letterhead, warning has been written in the bottom. You need to print this report in this letterhead. Here in report print preview, you can see some blank space in bottom of the report. You need to verify that height of this bottom blank space is enough to show printed material in bottom of the letterhead. Print this report. In printed report on letterhead, you can see overlapping between printed material in bottom of letterhead and doctor details. Here you need to increase height of bottom blank space. To increase height of bottom blank space, go to application settings form. Here you can see number of blank lines in footer are set on 4. To increase bottom blank space in report print preview, increase number of blank lines in footer. Suppose you are setting number of blank lines in footer to 7. Click on Save button. Regenerate print preview of test report. Here you can see height of bottom blank space is increased. Print this report. In printed report on letterhead, you can see doctor details are coming just above of printed material in bottom of letterhead, which is perfect. Suppose you have letterhead having printed material in top and bottom of the A4 paper sheet. Here doctor details are also printed in letterhead. Suppose you need to print this report in this letterhead. You have already seen in report print preview that doctor details are also coming with test result. To hide doctor details in report print preview, select blank from right sign drop down list and generate report print preview. In report print preview, doctor details are not coming. As you know, if you are going to reopen other test result form, then you will find my sign is selected in right sign drop down list. So you need to make blank selection permanent in right sign drop down list. To make blank selection permanent in right sign drop down list, go to application settings form. Select blank from right sign drop down list and click on save button. Now reopen other test result form. Blank is selected in right sign drop down list. Here there are still chances that somebody will select doctor details from right sign drop down list and left sign drop down list, and doctor details will appear in report print preview. To avoid this, go to application settings form, unselect show doctor details option and click on save button. Here in other test result form, if you will select doctor details from right sign and left sign drop down list, and generate report print preview, but doctor details will not appear in report print preview.